Happy Sabbath, everyone. My name is Dr. Marcia Harris, and I was asked to do Health Spotlight today. I had actually forgotten that this weekend was Mother's Day weekend, and I think it's actually quite appropriate then that the topic today is gynecologic cancers. GYN cancers are not female cancers because female cancers would include breast, and I'm not going to speak about breast. Dr. McIntosh, I'm sure, already has, or if she hasn't, she will. But GYN cancers are the cancers of the reproductive system, the uterus, the tubes, the ovaries, the cervix, the vagina, and the vulva would qualify as gynecologic cancers. And they're quite important. I'll tell you that 40 years ago when I started doing this, they were a major source of female deaths. I'm happy to report that those numbers have really decreased. Breast cancer kills more than 45,000 women in the United States every year. The most deadly gynecologic cancer right now is cancer of the ovary, which kills about 14 to 15,000 women every year. Now, when I started doing this 40 years ago, cervical cancers were as prevalent as breast cancer is today. Today, I'm happy to report that cervical cancers kill maybe 4,000 women every year. And that is just really amazing. But I'll tell you why that is. The screening test for cervical cancer, the pap smear, has now been streamlined. And as long as women go on a regular basis and get screened, it's now to the point where most of the time we can do something about it. Because cancer doesn't happen overnight. No cancer forms overnight. And specifically and especially cancers like cervical cancer, it starts out and has a prodrome. It goes from a few abnormal cells to more abnormal cells to precancerous cells to cancer. And that happens over a period of like 5 to 9 years. So it's very important, ladies, that you get your yearly pap smears and your yearly screenings. Now, I'll tell you, every now and then you will get a really aggressive cervical cancer where the person will have had a normal pap smear a year ago or less and will come in and will have a bad cancer. But that is unusual. The second type of gynecologic cancer, endometrial cancer, is cancer of the lining of the uterus. The number of deaths from endometrial cancer every year in this country are not very many. Matter of fact, they're not many more than we have with cervical. And again, that is because there are signs and symptoms which, if you get abnormal bleeding and you get abnormal menstruation, you are going to go in and you are going to get checked, and when they do a biopsy, they'll find it. So most of the time, it's found early enough that we can do something about it. The big problem is ovarian cancer. And the reason is because there is absolutely no screening test. Not only is there no screening test, but the symptoms are just very non-specific. Someone will have bloating, will have constipation, intermittent diarrhea, a little bit of belly pain, some indigestion type feeling. And the symptoms are just very, very non-specific. And they will go in and they'll find a big mass and they'll check it out and it'll be ovarian cancer. So a lot of times, by the time ovarian cancer is found, it has already spread. And that is what makes the difference. So ladies, please, you do want to get your screening tests done. You need to go in for an examination and pap smears on a regular, at least yearly basis. Also, you need to be examined, because that's really the only way ovarian cancer is found. Now, the other two parts of the female reproductive tract, the vulva and the vagina, do get cancers, but they're very, very rare. Again, as long as you're being screened, if something is there and something is found, then it would be, taken care of ahead of time. Very important, ladies, go and get regular screenings so that you will, if something comes up, it will be found on time that it can be fixed. May you prosper and be in health, even as your soul prospereth. Thank you.